Welcome once again to my channel. This is Aban Susanna, a community ambassador and a member of the Red Cross Society. Today we'll be treating hemorrhage and how to treat it. I mean the first aid methods or the first aid precautions for hemorrhage or bleeding. We usually call it bleeding, and hemorrhage is defined as the escape of blood from the blood vessels. And then any of our blood vessels can be involved. It can be the arteries, the veins, or the capillaries. So blood loss can be very very serious and therefore should be controlled as soon as possible. If there should be an accident right now and the casualty can either bleed physically or internally. So we call it external or internal bleeding. So the external is what you can see physically, you can see blood oozing, but in the internal, the blood is oozing out of the capillaries into an organ or in the body. So if the casualty loses a lot of blood, he or she may fall into a shock and then eventually lose consciousness or faint, and then the person might even die if it's not treated. So with external hemorrhage, the blood escapes from the blood vessels into the surface of the body. But then with the internal bleeding, the blood escapes from a blood vessels into a cavity or an organ in the body or even into tissues. So this type of bleeding cannot be seen, but with the external bleeding, it can be seen. There are different types of blood vessels that could be involved in bleeding or hemorrhage. As I said earlier on, we have capillaries, we have arteries, and then we have veins. So with the arterial bleeding, which is the bleeding from the artery, it's the artery is involved, and then the blood is usually bright red, very bright red, as a result of the enough oxygen in the blood. So because there is enough oxygen in the blood or more oxygen in the blood from the artery, it's usually bright red. But with the venous bleeding, which is the kind of bleeding in which the veins are involved, it is kind of dark red because the amount of oxygen in that blood is very very small. So that kind of bleeding is very dark. Then the last one, which is the capillary bleeding, is usually occurs in superficial bleeding wounds. So in this one, the blood oozes from the wound onto the body, and then this kind of blood isn't that bright red or nor dark red, so it can be between. So note that with lacerations or very kind of large damage or accidents, like accidents which involves a fatal accident, let's say a fatal accident, casualty hemorrhage may be as a result of all the kind of vessels. So in lacerations, all the kind of vessels may be involved, so they may be damaged. Then the blood, so the oozing wouldn't be arterial, wouldn't be venous, wouldn't be capillaries only, but the three of them may be involved depending on the part of the body that the person is injured. So also we have the time where hemorrhage can occur immediately there is the injury. It can occur after, or it can occur several days after the injury. So we have the primary hemorrhage, which is immediately the injury occurs. So let's say if I should get a sharp object and break myself with it, if blood oozes right now, it means that's primary. It's occurred, like the bleeding occurred immediately there was, or at the time of injury. But if it should occur maybe in the next 24 hours, let's say a surgery, or you did something did hit you, but then within 40 and 24 hours, it didn't happen at the time of injury, but it happened after, but it was within 40 and 24 hours, and that one is called a reactionary bleeding, because the body reacted before there was bleeding. So with that one, you wouldn't have the bleeding at that time of the injury, but it will happen within 24 hours of the injury. This means that the body reacted. So when the injury occurred to the body, it took time for the body to react before there was bleeding. So that one is called a reactionary hemorrhage. Then the last one is the secondary hemorrhage, where the secondary hemorrhage can occur within after 7 days, 7 to 10 days. So there will be an injury today, maybe an accident, and then those who were bleeding physically were sent to the hospital. But this particular individual didn't go to the hospital and didn't go for checkup. When he or she got home after 7 days, the person might start bleeding internally because you didn't know the kind of vessels that were involved. Because you didn't bleed physically, you thought you were okay, so you went home, but internally the organs are damaged, like the capillaries, the vessels are damaged, so there was bleeding. So the bleeding was done, was in the body, and then it was bleeding onto an organ or something. So this is mostly as a result of infection. So if the bleeding happens during after 7 to 10 days, it's as a result of infection. So the first one is the primary hemorrhage, which occurs at the time of injury. The second one is a reactionary, occurs as a result of the body reacting to the injury, and the last one occurs as a result of infection. So if there's an infection, then that's where the bleeding occurs. And the last, let's continue with, now we move to the point, the first aid treatment for hemorrhage. So the aims of giving first aid to someone who is bleeding, one is to control the bleeding, is to prevent infection, and then to prevent shock if possible, also to get the casualty to the hospital urgently. So let's note, one thing every first aider must note is that when you are giving first aid to someone, be very cautious of time, because every second matters. The person might die in the next 2, 3, 5 seconds or 30 seconds or minutes. It doesn't matter. But when you are attending to someone in with the objective of giving first aid so that the person might be transported, please do well to take note of time, like be time conscious. So in my country, the ambulance and all those stuffs might work, but to be on the safer side, before you attend to the patient or when you're attending to the casualty, get someone to arrange for transportation before you start the process. Or if you are the only person at the site of the injury or at the site, then when you are attending to the patient and the patient is kind of stable, you make sure you call for help or you call for transportation whilst you are continuing, so that by the time the transportation arrives, or the transport, the taxi or the car arrives, or the ambulance arrives, you are ready to transport the patient. So it wouldn't be like you attend to the patient before you go and look for transportation. Anything can happen at any time. That's why he said the time, be very, very time conscious. So with the treatment, you examine the wound to make sure there are no embedded objects like glass or something. Then you apply pressure to the wound by pressing the wound with your fingers. But if there should be an object, please don't press on it, press around it. Usually use a sterile dressing or something. So if there is an embedded object, press either side of it, around it. Then when you're done, whilst you are doing it, you reassure the patient that, oh, everything will be okay. You shouldn't, like, you should make the patient feel that as you are there to help, and you transport the patient to the hospital in no time for help, care to be given to the patient. So after that, you cover the wound immediately. This is to prevent microorganisms from settling, and this can cause infection. As you said earlier on, we are trying to prevent infection. And then also raise the limb. If it's the limb, it can never be the hand or the leg. You raise it so that you prevent shock or something. So you raise the limb, but you make sure it's over the heart level. Then also you dress the wound very nicely. Please use clean things, clean materials to dress the wound. After that, you check for shock. If there is any shock, then you try to treat it. Whilst you are waiting for the transportation, please make sure that the patient's vital signs are very normal. So you check frequently until the ambulance arrives, and then you write them down so that when the ambulance arrives, you give it to them so that they transport the patient to the hospital. So when they know that this is what you did for them. So whilst you are transporting the patient to the hospital, you still continue checking the vital signs for the patient. So this is how you treat hemorrhage or bleeding. Please make sure you subscribe and then you share after watching. Thank you very much.